If the court does not strike down the entire law, the House will move to repeal what's left of it.
This is not the first time that my community has rallied behind me.
It looked like he caught it going in. Now whether he holds on to it.
He didn't catch
No,
it.
he did not.
Close.
Well, good evening, everybody, and welcome to RFL. I'm Richard French, and thank you so much for joining us this Wednesday evening, June 27th. A lot to cover this hour. First, of course, health care on trial. We're awaiting arguably one of the most anticipated Supreme Court decisions in recent memory. The decision, expected tomorrow morning, may redefine the boundaries of government for years to come. Where does the line start and stop? We'll learn a lot from the 9 justices. And it'll also critically impact the election. Nobody debates that much. We're going to have what you need to know about tomorrow's expected decision. We're going to cover everything from the law to the politics and also the practicalities. And next, we're going to recap last night. Big night when it comes to New York politics. Some big surprises, as well as also some folks that are saying goodbye, and some folks, as you'll be joined here tonight, saying thank goodness for that. And later, we'll talk about a very troubling trend, teen sex assault. A shocking teen-on-teen sex assault in our region. It has thrown the issue into the spotlight. And if you think that this is just a rare occurrence that the media talks about because it's a sensational story, you're going to be shocked at how prevalent this is and how often this unfortunately happens. We're going to sit down with 2 experts who say sometimes teens so experienced they don't even know how to describe what happened to them. And then a bad call. During last night, if you watched the Indian-Yankees game, television crews, they caught something on camera that an umpire just refused to believe what's going on there. Well, we'll tell you about that. And plus, Yankees might have won today, but a couple injuries that aren't going to make you Yankee fans happy. We got all that and a lot more coming up in this edition of RFL, but let's start with healthcare on trial and our senior political correspondent, Andrew Whitman. He's in first position with the very latest.
Well, Rich, healthcare is the word today as we await one of the most anticipated Supreme Court decisions of the year or of the past several years. The court could rule any number of ways tomorrow, from striking down the entire law to striking down only the individual mandate or some combination in between. In the meantime, Republicans made it clear today what their response will be if healthcare reform is upheld.
If the court does not strike down the entire law, the House will move to repeal what's left of it. Obamacare is driving up the cost of health care and making it harder for small businesses to hire new workers.
The Obamacare bill was a mistake. We would like to see the kind of health care that will allow patients to make decisions, not bureaucrats here in Washington.
Tomorrow, a new chapter is going to be written in that book. We will hear the Supreme Court's decision, and we will move forward on that. And that chapter is not going to be a Republican chapter. It is not going to be a Democrat chapter. It is going to be the American healthcare solution chapter.
Now, how this plays out for the election is, of course, something of a question mark at this point because public opinion is so muddled on the issue. When asked about the Affordable Care Act itself, in general, the public is not supportive. But when you ask the folks about specific provisions, well, the support increases. For example, 82% of those polled support the idea of banning insurance companies from denying coverage to people with pre-existing conditions. 80% of Republicans favor creating an insurance pool where small businesses and the uninsured have access to insurance exchanges. And 52% of Republicans favor allowing children to stay on their parents' insurance plans until age 26, all part of the Obamacare plan. Complicating things further, the so-called Romney Care factor. When Massachusetts residents were asked last year about how they feel about their state health care plan, a plan that so-called Obamacare was modeled after, a vast majority liked it, which kind of puts the Republican nominee in the uncomfortable position of having to refute a plan he supported and that Massachusetts residents who have been living with the plan also support to the tune of 84%, Rich.
Pretty simply, we got a mess on our hands no matter what happens tomorrow, one way or the other, and it'll have big political implications. All right, let's bring in the panel on this. Jessica Proud here, the brains of this operation, Republican strategist, vice president at NLO Strategies. Dominic Carter, of course, political journalist, author. Ed Till, radio talk show host, and Andrew, who we've already met. All right, Jessica, I'm going to start with you. We're going to go around. What do you think happens tomorrow? We know this much, that Justice Roberts, Chief Justice Roberts, he's going to be delivering the majority opinion here. Again, reading tea leaves, but what's your gut tell you?
I think the individual mandate will likely be struck down, which would be a huge win for the Republicans. It's true, everyone is waiting with bated breath, and it's going to have a big impact. But you heard Boehner say today, you know, whatever isn't struck down, they're going to try and do it legislatively. I do think if that's the tone that they're going to take, they need to come up with their own plan, because people do want to see some sort of health insurance reform. So I think just saying they're going to scrap it all together in the long run might not be the best idea, but it is a win-win either way.
Dom?
Not sure. When it comes to the Supreme Court, I don't think in general it's a good idea to try and read tea leaves, if you will. I have no idea what they're going to do, but I can tell you this much. The stakes are extremely high for both of the major presidential candidates.
I've heard two arguments, Dom, which is if the court strikes it down in whole or in part, the president wins. Because the president can say, hey, now I've got one more branch here that's a political branch here, and the big one legislative victory here, they went out of their way to stop it when everybody said this wasn't even on the table. Flip side is what Romney said today. What else has he done in his first term here? The one big accomplishment out the window. Does this help or hurt him if he's seen here as a loser tomorrow by the high court?
Well, it depends on who's looking at this. If you're one of the folks that hates President Obama.
How about those undecideds?
Those undecideds, I'm not sure. I will say this much. His base, it will energize his base if he loses tomorrow.
Andrew, when you break the numbers down, you did some of it, right? People say, you know what, I'm conflicted on the thing. I'm not really sure if I really like it. But then you say, okay, let's break down what's in this thing. Pre-existing conditions, covering the kids to 26, et cetera, right? They like it. And they like it in big numbers here. Maybe, I think we all agree, the administration did a real crummy job here selling this thing what they really did. That said, though, do you think that it can be articulated to the public what will be lost or gained tomorrow, or is this so complicated people won't know what the heck happened other than what the headline says?
You know, I think most people are going to look at the headline and take that in terms of the one loss. I think you're going to start seeing, if part of it is torn down, you'll see Republicans, as Jessica was mentioning, trying to tear down other portions of it, but also trying to pass part of it again. The protection up to 26, I think, has bipartisan support at this point, but it won't be ascribed as a victory for the president if they go ahead and they do that. So, you know, in terms of analyzing the result, I don't think people are going to read a lot past the top line of the whole thing. In terms of the individual components, well, you know, if John Boehner is seen as providing coverage for people up to 26 instead of President Obama, that's what should be a big win for the president actually turns into a big loss.
You know, Ed, and the part of this that people don't want to hear because it's even more complicated is I talked to hospital presidents and they said, we finally got all the mandates in place here and the mechanisms to at least adhere to what we're told. And what we had to get done by 2014, they throw this thing out, what the heck do we do? And then I've got other people saying, my kid's now on health insurance, my kid's finally covered. What happens to him if this thing goes out? There are so many practical considerations to this. Will people all of a sudden maybe wake up and say, wait a second here, I might not have been crazy about this, but I didn't realize what happened to me. All of a sudden my pre-existing condition's not covered anymore. Will there be buyer's remorse if the high court smacks this thing down?
Well, you know, it's an excellent point, because as we reviewed the data, if you notice what the American people do like, 52% of them oppose the idea. Once you talk about what they get from it, what benefits them directly, that's where their desires lie. The talk up to this point has been, I hope the Supreme Court does this, I hope the Supreme Court does that. The president himself made statements in advance of the Supreme Court decision saying how he wished it would go. Using the Supreme Court as a soccer ball on the issue of health care undercuts what the real consequences will be.
And we were talking about Justice Scalia's dissenting opinion on immigration and the shot that he took at the president. This thing is getting ugly here, and it's not just behind the scenes. This is for the public to see. A lot of people thought the president shouldn't have taken a shot at the high court himself. But this will come down, everybody. Tomorrow morning, we anticipate around the 10 o'clock hour, we're going to get the decision of the court, and then you're going to hear all you-know-what break loose from both sides as to what it really means. And trust me, it will mean a lot in this election year.